On behalf of the government of St. Martin, I welcome you to today's press conference dealing with the current state of affairs as it relates to the COVID-19 virus and the confirmation of said cases on the island at this time. To deliver the opening remarks on this topic, I now ask the Prime Minister of St. Martin, the Honorable Severia Jacobs, to address you.
Thank you, Cedric. Good morning or good afternoon to you, the panel, as well as those in the Tribune, I would say, the media, and the people of St. Martin. As you may know, I did do an interview with PJ82 this morning, but I felt it necessary to do a press conference so that the general public is aware that this morning we activated the Emergency Operations Center, known as the EOC, in connection with 2 confirmed cases of the coronavirus, also known as COVID-19, on French St. Martin. The persons that have been quarantined at the hospital on the French side will remain there for 14 days. Why is this considered then an emergency for Dutch St. Martin is because we can confirm that these 2 passengers were indeed on the Dutch side and did enter through the airport on the 21st of this month of February. Yes, so they were in the Caribbean region. They traveled via France to St. Martin to get to St. Bart's. This was done via boat from St. Martin to St. Bart's, and then the same way they returned. On Friday morning, they entered St. Martin via Great Bay Marina. On the shuttle towards the airport, we can confirm where they were in contact with the general public of St. Martin. What is clear is that these 2 passengers did not exhibit any symptoms, but had been flagged due to where they had originated from. As we know, over the past week, certain areas within France and Italy have been highlighted as hotspots, you can say, and areas of concern, but had not been such when they had left France. So that is why they were not blocked from entering at that time. So now that it has been highlighted and the list has been updated by the World Health Organization to include places such as Loise, France, and places within Italy, this has been highlighted in the carriers that are coming from those regions already during this week. I must commend the cooperation between the French and Dutch authorities, police, immigration, as well as public health, who collaborated intensely on Friday to ensure that the passengers were isolated as soon as that information was made known to, at that time, St. Bart's. At this moment, the French side has confirmed that the cases remain isolated. They are not a threat to St. Martin at this time. They will be monitored for the 14 days. What is clear is that the St. Martin Dutch side, we are an open hub, and we must remain vigilant. And we are happy to see that the protocols in place are working. We know that the public is becoming riled up, as you may say, over the past week, every time there is a suspicion or a case. But we have been handling according to the protocols. Public health is here with me, represented by epidemiologist Mrs. Eva Lista de Weaver. She will, in a few minutes, enlighten the general public as to the public health protocols that have been in place, are standard, but have been heightened over the past few weeks, and especially now since our confirmation of the 2 cases that have passed through our borders. What I must reiterate, however, is that St. Martin, Dutch side, has 0 cases that are either suspected or confirmed as having COVID-19. So that is my opening statement. We have increased We have increased or heightened travel restrictions, as I mentioned, and scrutiny in place by our main carriers. We are expanding that also to the USA and the Caribbean because we also receive many flights through those areas. Prior to this, let's say, scare, we heavily relied upon the ports of entry where the carriers were bringing in passengers, especially Europe and the USA have very stringent protocols in place in terms of questioning passengers about their countries of visitation up to 2 weeks prior to getting on a flight. So we utilize those protocols, and upon entry to St. Martin, where cases may seem to be at risk, they have been pulled out, questioned similarly, and allowed to proceed if they pass the scrutiny tests. We have also heightened our scrutiny at our ports of entry at the harbor. Health and travel protocols are already in place, and heightened awareness will be invoked where needed. Emphasis will be placed in addition to the school-going population through their respective school boards. So the Public Health Department has already been in contact over a month already, issuing statements to the schools and school boards that have to go out to parents and children, to schools particularly about heightened hygienic practices within the schools and within homes, of course. We know that once we educate children that it can permeate the population much faster. So that will also be heightened by another letter that will be issued today from the Department of Public Health, giving admonition to the schools as to what the protocol should be, and to give pamphlets out to the parents as well during the week. Vigilance and heightened protocols are also a must for all frontline personnel. For example, immigration officers, medical staff, customer service representatives in all industries. CPS stands ready to assist any of these industries if extra workshops and the like are needed. However, over the past couple weeks, if you have been following, we have been issuing certain protocols that should be raised in terms of washing hands, keeping hands away from the face, especially the eyes and nose and mouth, and using hand sanitizer as often as possible to avoid any cross-contamination. Our regional and international, as well as kingdom partners, have been engaged for the last couple of weeks, and of course, seeing the current state of affairs, these will also be heightened in order to inform, as well as to have the channels open if assistance is necessary. So all our international and regional partners have been alerted. We know what our status is. We know what our levels of readiness is in terms of supplies, location for isolation, and they stand at the ready to assist us as needed. So with that, I would now turn the word over to Mrs. DeWeaver, Lista DeWeaver. I've been calling her Ava all day. So she will now update you as our epidemiologist as to the protocols in little more detail where public health is concerned. Ava?
Thank you, Prime Minister. I just wanted to reiterate, so the normal process, as mandated by our public health legislation, is that any infectious disease is to be reported to collective prevention services. When that is reported, whether it's by the laboratory or the physician, part of our normal process is that we follow up with the physician, gather more information, and in turn contact the patient or the cases to ensure that we get the necessary information to have an epidemiology of what transpired, how they could have gotten, the infectious disease, any travel, just try to gather the necessary information in order to make an informed decision in terms of next steps. So part of not only getting the diagnosis is making sure that they're well informed about prevention measures, what we need from them in terms of follow-up. And so that has been the usual practice over the last few years. More specifically with the COVID-19, what we've done over the past few weeks is we've met with our Friendside counterparts to assess our preparedness and response efforts and measures, and also to have a dialogue of how we normally communicate, and in this instance, if need be, how do we heighten that communication so that both parties are aware of what's happening on both sides. So it's been extremely important also for us when we are in dialogue with the friend side that we get the necessary information before we react. And so, over the past couple of weeks, it's exchanging protocols, exchanging case definitions, because the French side follows case definitions as mandated by France. We follow definitions by the Netherlands. So it's being aware of each other's case definitions and what's being used, and just ensuring, as the Prime Minister said, that we work and collaborate together for information exchange. We've also met with St. Martin Medical Center. We met with a couple of representatives from the general practitioners. We've met with our laboratory partners just to assess their readiness and to assess where, if need be, we would need to support them, and in turn, they would need to support us. We've also met with leadership from the Red Cross and WEAMS, especially for education and awareness to the public. We've also had a focus group discussion and development of our protocols, or enhancement of our protocols, with ports of entry. So the airport and the ports and immigration services, looking at escalating or heightening our awareness, making sure that we're all aware of our follow-up measures should a suspected case arrive on St. Martin. So I'm confident that we have that communication channel. It's pretty strong and it's well established, and we just need to, as the Prime Minister said, remain calm from an epidemiology perspective, make sure that we have all of the information that we need, you know, whether it's signs and symptoms, whether it's travel history, but in order to gather and make proper assessments of our next steps, we need to make sure that we have the full picture before we can inform our measures appropriately. Thank you.
Thank you very much, Mrs. Lister de Weaver, for your remarks. Prime Minister, thank you as well for yours. At this time, to get more on the medical side of the perspective of the issue, we'd like to ask Ms. Dr. Sameh Naderi of the St. Martin Medical Center to address you at this time.
Thank you very much for the introduction. I'm very glad that for the organizing in such a rapid tempo, such a great preparedness, and which we should be proud of. Luckily, we don't have any confirmed case or suspect case at the Dutch St. Martin to start with. So this is a disease which we call that zoonotic, which means that between human being and the animals, the transmission takes place from animal to the human being. So also, once the human is infected, the virus could be transmitted to the other humans. But not everybody transmit the virus to other people, and also not everybody gets sick. Once the person gets infected, it takes 1 up to 14 days before the symptoms appears. So once the symptom appear, then there is a chance of transmission between the humans. In the majority of the cases, the virus cause no symptoms at all. So almost 80% of the population that gets the virus will not develop any symptoms at all. So that's a good thing. If a person doesn't have symptoms, the chance of transmission is extremely low to start with. So, but still, we want to have our preparedness. And that is in case if the transmission gets more, or in case if the patients are getting sick. So how sicker is the patient, how more will be the risk of transmission. So to protect the other population, we have to be very alert, right? What are the symptoms? Basically, the symptoms are just like flu. At the beginning, it was very mild symptoms. Later, it could develop to cough, runny nose, tiredness, fever, of course, in some cases, shortness of breath. And 1 in 6 patients with coronavirus, with this type of virus, they're developing severe symptoms. Those patients need admission. So as long as we are staying with a good hand hygiene, good protection, avoiding contact with patients who are sick, then the transmission will not take place. And whenever a person gets sick of any respiratory symptoms, such as fever, cough, sneezing, or runny nose, advises to stay home and contact the doctor. And then from there, we will take it further. The general practitioner, the public health, and the hospital, and the laboratory, we all work together to limit the risk of transmission to the other population. So at this point, I could say that luckily we don't have any positive case at the Dash St. Martin. The 2 positive cases from a French side, as Prime Minister stated, was in sort of a transit phase. The risk of transmission from those 2 persons to other population is very low. There is no reason to be worried about it, but we have to be prepared all the time, and that is what we are doing.
Thank you very much, Dr. Nadiri, for your opening remarks. I'd like to open the floor for any questions that the media might have. Was there any statements can be expected from a tourism perspective? Okay, now I'll ask the head of the St. Martin Tourism Bureau, Ms. Mei-Ling Chun, to address you.
Good afternoon, media, ladies and gentlemen. Thank you for coming here today. Basically, from a tourism perspective, we've been in close contact with our stakeholders, and they have their system in place, which is basically, and our stakeholders we consider hotel, resorts, the private sector stakeholders. They have taken precaution, have beefed up their let's say, information also within their establishments and for visitors and clients they have. We have shared with them, of course, what government provides. So VSA has provided infographics, which are the World Health Organization infographics, and that has been distributed as well, and they'll use those, including their own internal protocols. So each individual hotels have beefed up their hygiene procedures. So we also, from a tourism perspective, it is important that we keep our visitors safe as well. And we want to emphasize to stick to the facts and stick to the information that is provided. We know there's a lot of social media going on and group chats. We ask that these things are kept in control. You cannot always control them, but that we try as much as possible as a community also to stick to the facts. We are the hub of the Caribbean. We are an important hub, and therefore I believe these strict procedures that we have now, that we have provided you the information with, has to go out there and for people to understand that procedures are followed, and this is including also for our visitors.
Thank you very much, Ms. Chun, for your remarks. I'll now open the floor for questions the media might have. Dr. Sock, Jeffrey Sock on the Island 92 FM, you have the floor.
Thank you very much. I would like to, if we could, maybe discuss for us, and I'm not sure if it's best from the ministry or from the medical center, perhaps to understand in a little more detail some of the screening, some of the procedures. What happens when someone arrives either at the airport or one of our other borders and is suspected of either being from one of the hotspots, as the Prime Minister indicated, or is suspected of having the virus? What are the actual procedures? What can people expect?
Thank you, Dr. Sock. That's what you said your name was?
Yes, thank you.
Yes, I'd hope to have made that clear, but both ports have their protocols in place, which include knowing just before a plane leaves. With the airlines, it is the manifest that comes once the plane is about to depart from the destination. And with the cruise lines, we have 48-hour checks 24-hour checks, and up to 12-hour checks if the port deems that necessary. Where CPS is involved, medical declarations must be issued specifically for the cruises, and that is a standard operation for every cruise line that enters the harbor or the port. So if the cases or whatever the cases are, they must be highlighted to the CPS, and CPS then grants the go-ahead for the ship to berth. In cases where there's a suspicion, especially in the last few weeks, the minister has been issuing those OKs, the Minister of Public Health. So that's a standard procedure, which, as you know, one of our press releases yesterday also pertained to that. Those that come through the airport, again, those screening questions would have been asked upon check-in at the port where they entered and took the flight to St. Martin. Once they come to St. Martin, if there is suspicion by our immigration officers, they have a list of questions that they would ask, and if there is a suspicion, then there are holding rooms where then the airport physician gets involved. So those protocols have been in place and are being utilized at the moment. So for instance, we've had a case where a traveler came in and in transit, and the destination where they had to go did not want to accept them or allow them to check in here in St. Martin until a declaration had been issued. It actually took more time to be able to have that because the person had no symptoms, they had nothing, they were actually citizen of the country where they were going. But based on where they had traveled to, that country required extra protocols to be in place. So those are things that we've also had to take into consideration. So in that case, then automatically the immigration department is called in and those protocols are followed as such. Isolation from the airport is possible. Isolation is then, if necessary, taken to whichever hospital the person belongs at. As with the French couple, they were taken to the French side, but if it is a case for the Dutch side, there are isolation rooms also available, capabilities at St. Martin Medical Center, and we have alerted our international and kingdom partners as to what our maximum capacity is, as well as to how soon we will alert that more assistance is needed. On island, we also have opportunities for emergency isolation locations that can be established as needed. So those protocols are in place. The airlines have been, again, updated with a new list this past week from the World Health Organization, where not just China, they're not only just asking about China, but they're now asking about other countries within Europe and the USA that have become now known areas where there are clusters of coronavirus that are confirmed. So they have to go through that checklist, and once they have been exposed during that 2-week period, they're not allowed to travel to St. Martin. I hope that answers your question.
Thank you very much, Prime Minister. I do appreciate it. If I might ask one other question, if that's...
We actually want to
okay.
actually just have one round, and any further questions, we'll ask you to direct those to the Department of Communication that we could then pass on to the EOC for further handling. Prime Minister, thank you very much for answering that question, and Jeff, thank you for your question. Now move on to the Daily Herald, represented by Mr. Robert Lecoq. Thank you for your question at this time, please.
The French side press release today from the Regional Health Authority wasn't completely clear about the 2 cases in St. Martin. Do you have, from what you said, Prime Minister, is that the coronavirus was confirmed? But in the press release, it suggested the results were not back yet. So, and also, if that is the same couple that was taken from the airport and not a different couple, just to clarify.
Thank you, Mr. Lecoq. I think that confusion you're having is that the French side has notified us that the confirmed case, the confirmed cases that were isolated at Juliana on February 28th, which was Friday, during the day, they arrived, as I mentioned in my opening statements, around 10:30 via shuttle to the airport, checked in and were isolated once they'd gotten to the identified in the departure hall. So we can, via our CCTV at the airport, track their movements throughout the airport and have done that. So in terms of their contact tracing, that is in place. These persons were then transported to the medical facility in the, not Marigo, what you call that? Concordia, yes, Concordia, and there they've been isolated and tests were run. They remain isolated. The test results for those two individuals came back positive. In the meantime, according to what was told to us today, there are two other suspected cases that they have at the same hospital, which they have inconclusive or they have not received confirmed or negative tests for as yet. Those we do not have any information on as the Dutch side of St. Martin. So that information you will have to get from French St. Martin. What we know about is the two confirmed cases that have passed through Dutch St. Martin, as well as that one case was a negative. So they were actually over the past 2 days looking at 3 cases that we know of, and one was also in transit on the French side, contacted themselves, checked themselves out, they were negative. So they just had simple influenza and they were supposed to go on a cruise, which of course they cannot do now because they have influenza. But that is a negative case. The other 2 cases that the French side is talking about, St. Martin, Dutch side has no information on that.
Thank you, Prime Minister. And Robert, thank you for your question. Stephen
you.
Cerillion, PJD2 Radio, you have the floor.
Thank you, Cedric. Good afternoon to all. My question is for the doctor. Obviously, based on reports, this thing will get worse before it gets better. How well equipped is the medical center in case of any eventualities?
Thank you very much. It's a very good question. To start with is the COVID-19 is very contagious, but less aggressive than SARS and less aggressive than MERS, which are 2 other types of coronavirus diseases which happened in the past from animal to human. But the good thing is that it's not done as severe as SARS. St. Martin Medical Center has its proper protocol in place. We updated our protocol recently, just 2 days ago. We have the capacity for, at this time while I'm talking, we have the capacity to accept 4 patients, whereby 2 patients with severe symptoms. So we are able to treat them and stabilize them for 4 patients. If we receive a very sick patient which needs ventilation, which means mechanical ventilation, so those patients needs to be sent abroad. And the authorities are in close contact with other countries to see how can we manage and how can we transfer if this is necessary.
Thank you very much, Dr. Naderi, for your response, and Stephen, thank you very much for your question. As indicated, members of the media, we're only entertaining 1 round of questions in the setting of this press conference. Any additional questions that you might have, please feel free to send those questions over to dcom@stmartingov.org. We'll be sure to pass that on over to the EOC for further handling. And of course, I want to allow the Prime Minister at this time to close off this press conference with our closing remarks. Prime Minister?
Thank you, Cedric. I'd like to add a little bit to what Dr. Naderi mentioned pertaining to the St. Martin Medical Center. From our EOC meeting, we were able to clarify that there are already existing protocols where he mentioned that St. Martin, once it reaches to a level, we know that we ship our patients out. We have an agreement with the hospital in Curacao specifically at the moment to deal with those types of cases. But of course, seeing now that it is COVID, we have to ensure that they would accept a COVID patient if that is what the case is. That is why I mentioned initially we are in discussion with our Kingdom partners, as well as United Nations of affiliations with UNDAC, which we established strongly post-Hurricanes Irma, whereby if it is necessary that mobile units can be dispatched within a short period of time, as well as to utilize the emergency services location that has already been identified close to the hospital, if it is more than what the hospital can handle. We've also informed them that seeing that we can hold such a limited amount of persons with such respiratory illness on the island at the hospital, that we, from the time we would have, say, 2 cases confirmed, we would already alert that it is a high emergency case and we need support in this. So that is our protocol. Once we have 2, it is already considered too much for the island to handle, because the medical center can handle any local and or sporadic visitor situation, but something that can escalate quickly, we would want to nip it in the bud, because isolation is the only way to ensure that it is not spread. So that is why the two passengers were isolated as they were, transported, and I continue to be isolated at least for the next 14 days. If their symptoms get worse, of course, they would have to be retested again. What our epidemiologist has reiterated also is that the protocol insists that you do a second test to confirm, not just one test that says positive is used, then a second test would have to be done to confirm, and she has not been able to see those tests as yet. So as such, we are awaiting the actual documentation from the French side, whereby we can see the lab results, whereby she can see the lab results to be able to give confirmation that the second test also was done. So the protocols are in place. They are according to international regulations. St. Martin knows its limitations and will most definitely highlight that to our kingdom partners and international partners in order to be able to contain this, especially seeing the hub function that we serve within the Caribbean, as well as to continue to protect our citizens. I would like to reiterate that until the hotline number is established, which is in process, that the general public should call the public health numbers of 520-1348 or 520-5283, 520-4523. These numbers will continue to be broadcast as emergency numbers should anyone feel the need to go beyond calling their GPs if they do fall ill. It is still our preventative measures and proper hygiene practices can help to prevent the spread of this virus. This is how individuals, families, organizations, schools can protect themselves. Ensure that you have proper hand washing techniques in place. Our promotions would tell you sing happy birthday twice. That is then the length of time that you should use to wash your hands with soap. Cough and sneeze etiquette, I will demonstrate. In your elbow or shoulder, or cover it completely with tissue, napkin, or a handkerchief. We do not promote handkerchiefs because that stays in your hand. Dispose of your whatever you use to cough in or sneeze in immediately, and wash hands or use hand sanitizer as often as possible. Throw away your tissues in the garbage bin and avoid touching your eyes, mouth, and your face in general, because that is the only way the virus gets in contact with you. Upgrade your cleaning protocols around your home, within organizations such as schools where there's high traffic. We are also leading here by example in government and having the cleaning crew do an hourly walkthrough, cleaning door handles, knobs, elevator buttons, anything the general public can get in contact with. So if every individual really educates themselves, of course, government is putting out more propaganda, more information. We will be utilizing also the digital boards to inform the public, to remind the public about their hygiene habits. Children, especially parents, teach your children the proper hygiene etiquette. Schools will be reiterating this as well. And in this way, we will avoid the spread of the disease. We are using good international protocols to identify early. We are seeing that this has worked. The couple that has been identified did not display any excessive or anything other than you would see normally if someone, you know, these days if anyone coughs in a room, everyone ducks. But up to, how many, 3 feet distance is already is considered safe. If you feel that you've been in contact with someone who may be at risk, remain isolated at home. If you develop symptoms, contact your doctor, maintain proper hygiene, and we should be able to contain it. CPS also has in place that if you are considered then isolated at home, that a unit will be checking in on you and continuing to update us and them to ensure that we can continue to monitor the disease, the virus, I'm sorry. So all steps are being taken. Report if you are feeling sick or ill. These statements will come out again in writing again and will continue to be promoted on as often as necessary. But of course, many people are watching the news. They are following different broadcasts. That is great, but you must not follow hype broadcasts. Do not allow alarming persons to influence you in that way. Follow the government-related news organizations, stmartingov.org. The hospital would put out also, CPS would put out also, but because we have activated the EOC, I will be the one from here on in doing the announcements, making the announcements to ensure that decisions are taken quickly and that we can follow up as soon as possible to ensure the safety of the population.
Prime Minister, thank you very much. Members of the panel, thank you very much for your participation in today's press conference, and of course to the members of the media, thank you for your participation. It brings us to the end of our press conference. If you've missed the press conference, be sure to log on to the official government website, stmartingov.org, for rebroadcast and video on demand, and be sure to tune into the official government radio station, St. Martin Gov 107.9 FM, for rebroadcast throughout the course of the day. On behalf of all of us at the Department of Communication, of course, the members of the Emergency Operations Center, I'm Cedric Peterson. Thanks for joining us.